Okay. In the name of Allah, the most beneficent, the most merciful. Today we are going to talk. I'm going to talk to you again about oral health. So 2 weeks ago we started the discussion about oral and dental health, and we talked about the importance of maintaining good oral health, and that there is a link. There's a lot of evidence to say that to confirm that there is a link between our oral health and our general health. So there is evidence. There's increasing evidence to suggest that there is individuals who have poor oral health. This can have an effect on their general health as well. So there is a link between heart disease, cancer, diabetes, and our oral health. So clearly, if we want to live healthy lives, we need to look after our oral health. We need to think about how we can maintain good oral health, how we can prevent oral diseases, as this will not only help with our eating and our appearance, but it will also help with our overall general health. So that's something we should always remember. Now, dentists dentists play an important role in promoting oral health and disease prevention. So we talked about the common dental problems which we face, and these are tooth decay, also known as dental caries, gum disease, also known as periodontal disease. We also talked about tooth wear, and as being one of the major dental problems we face. And there are 3 or 4 different types of tooth wear. We have erosion, we have attrition, and we have abrasion. And we also have something called abfraction. We will, inshallah, discuss, go into more detail about the different types of tooth wear in future sessions, inshallah. There's also a problem some individuals have, which is known as halitosis, and this is also known as bad breath. So some individuals have this problem as well, this dental problem. Another major problem is tooth sensitivity, which is common in the population, and this can be seen in all in adults, mainly in adults of all ages, and it's less common. It's very less common in children, tooth sensitivity. Inshallah, again, we will in a future session we will talk about tooth sensitivity and what causes tooth sensitivity and how we can prevent it and how we can treat it. One of the major dental problems we have are dental emergencies, which essentially arise because of individuals who, for example, have not been to the dentist on a regular basis, and they have developed dental decay or gum disease, and therefore have a dental emergency. So this is another big topic which we can dissect in future sessions, inshallah. Of course, one of the other major problems in dental problems we have as in individuals, we see in individuals, are aesthetic problems, and they can be due to the position of the teeth. They can be due to the color of the teeth. They can be due to the shape of the teeth, or they can be due to a combination of the positions, the color, and the shape of the teeth, which again requires a session on its own to discuss, at least a session on that. And also we're seeing patients with dentofacial problems. For example, patients visit the dentist requesting Botox or fillers because they're not completely happy with their sort of dentofacial appearance. There are also other problems we see which are sort of categorized under oral medicine, and these can be like ulcers in the mouth ulcers. They can be white or red patches. There can be changes in the appearance of the mouth, of the tongue, of the cheeks, or the palate, and these are under sort of categorized under oral medicine. And one of the conditions is also mouth cancers as well, which there are different types of mouth cancers, and squamous cell carcinoma being the most common of mouth cancers. That also requires a number of sessions to discuss and dissect, inshallah. So these are the main problems we have, and we see on a day-to-day basis when patients attend their dentist. In the previous session, we talked about how we can prevent. So we said that most dental problems can be prevented, and to prevent these problems, we require the correct education and the knowledge. And this starts usually from home, from our parents to educate us, and also when we go to school, our teachers to educate us about good dental health. So most, if not all, problems can be prevented, and that's the sort of focus that we would like to have, inshallah. I'm happy to sort of talk about in more detail about the different types of dental problems. For example, tooth decay, gum disease, tooth wear, and tooth sensitivity, and all of these conditions. I'm happy to go into more detail about those in future sessions. So obviously we're living at a time right now where there's a global pandemic, and this has had a profound effect on our access to dental services, and also access to dental treatments and services. Probably most people who are watching this have not been able to see their dentist during the past sort of 3 or 4 months, and many people have probably had to resort to home remedies to sort of treat their dental problems. Now dental practices have reopened, and they are starting to resume their services to their patients, and most dental practices are providing basic treatments again, and inshallah in the next few months they will increase their services to their patients. So it's very important to wash your hands before you brush your teeth, and wash your hands well with soap and water at least for 20 to 30 seconds, and ensure that you're not putting your fingers into your mouth if they are not clean. So this is very important, especially if you've just come home from outside. You should wash your hands, and then, for example, if you want to floss or clean your teeth, you can say if that's safe to do so at that point. So I would recommend everybody to be careful especially during the virus pandemic. Wash their hands. We should all be brushing our teeth at least twice per day, and we should be using a high fluoride toothpaste, ideally a toothpaste called Durafat 5000. And this toothpaste is available through your dentist or through your GP as a prescription. And this toothpaste has higher levels of fluoride, which is highly recommended for your teeth, for your protection of your teeth long term. So we should be brushing our teeth twice per day, at least about 2 to 3 minutes each time. Excuse me. And so this is something which I'm sure everybody knows, but sometimes we just forget, or we need reminding. So we should bear this in mind. Sometimes if you find you're not able to brush your teeth, you can rinse your mouth with either a mouthwash or salt water, and this will help to neutralize the acids which have been produced in the mouth due to the food or the drinks that you've consumed. So if you find you can't brush your teeth when you're out, you don't have access to your toothbrush and your toothpaste, then you can rinse your mouth at least with some water or a mouthwash, or something like that, which will also help. There are brushing your teeth is not the only way to clean your teeth. It's not adequate just to be brushing your teeth twice per day. You also need to be cleaning in between your teeth where the plaque and the bacteria are built up. And so you do need to also at least once per day floss your teeth, which is very important, so that you don't develop cavities and gum disease in the areas between your teeth. So dental floss is highly recommended. And interdental brushes are also highly recommended because they also clean in the areas where your toothbrush can't reach, and they help to prevent cavities developing or gum disease developing in between your teeth. So once again, I recommend everybody to clean with interdental brushes, which inshallah we can talk about in more detail, because there are different types and different products available from the shops. So these are important daily recommendations. However, sometimes we find that people, they don't go to the dentist unless they have a problem, like they have a toothache or a broken filling, or their crown is loose. Now, this is not the way to go. This is not the recommended method in terms of visiting your dentist. You should visit your dentist every year, at least once a year. Even if you don't have any problems, no sensitivity, no pain, no problems, you should still visit your dentist so that they can check every area in your mouth, check your teeth, and make sure that there are no early signs of disease. So I strongly recommend everybody to visit their dentist at least once per year, and maybe even twice per year. Visit your dental hygienist as well. So these recommendations are to prevent problems in the first instance. So prevention is always better than cure in medicine and in dentistry, as I'm sure you are aware. So inshallah, in future sessions we will talk about all the different types of dental diseases in much more detail, and everybody can have a better understanding about what causes these diseases, how these diseases can be prevented, and how what treatments are available if and when one develops these problems. Inshallah, we will discuss that. And so I'll hand over the session to Agha Siamak